my name is Dr. Melissa Stiles with the University of Wisconsin Department of Family Medicine. Welcome to today's Fam Medcast. I'm joined by Dr. Ann Eglash, Associate Clinical Professor with the University of Wisconsin, and we're going to be talking about breastfeeding in well-child exams. Welcome.
Thank you, and thanks for having me.
First, Dr. Eglash, why do physicians need to be educated about breastfeeding?
Physicians play a very important role in supporting breastfeeding women with problems that they have for themselves and for the baby. It's crucial that physicians gain this knowledge, and unfortunately, this knowledge has not been available for physicians while they're in medical school or in residency.
How can physicians do a better job in their office setting supporting breastfeeding?
There are several ways that physicians can support breastfeeding women. One way would be to make sure the physical plant is comfortable and accommodating so that women have a safe, comfortable place to nurse and feel welcome. It's also very important that the staff be trained on how to support breastfeeding women so that the babies remain healthy with breastfeeding and they're giving adequate evidence-based advice on how to support mom and baby.
In general, how do you start the discussion about breastfeeding with parents?
Ideally, it's wonderful to talk to women before they become pregnant. This is something that can be discussed during women exams, talking about the function of the breast. However, most women are ready for this discussion once they become pregnant. So even being able to talk to women during their pregnancy is crucial to help them make the proper feeding decision.
When do you like to see babies back from the hospital after the delivery?
After babies are born, it's very important that babies be seen within the first 72 hours after hospital discharge. This is a very crucial time for breastfeeding because it's often on day 3, which is the day after discharge, that women may start to experience some engorgement and significant changes in their breasts, and they need support regarding this. Oftentimes this can be accompanied by difficulty with the baby latching, and if mom's milk is not increasing, this is a time where the baby needs to be seen to make sure the baby is safe in terms of fluid management, to make sure the baby's not having trouble with jaundice or excessive dehydration.
What should be covered at the 2-week well-child visit regarding breastfeeding?
The 2-week well-child visit is a wonderful time to address a number of breastfeeding issues. One thing, it's a great time for women to be encouraged to think about their child care that they may need when they go back to work, and issues about human milk storage. Make sure they have the information for this. Oftentimes they have questions about when can they introduce a pacifier and when should they introduce a bottle. And in fact, if breastfeeding is going very well at that time, it's certainly fine for them to introduce those things. Many women want to know, is it normal for a baby to feed so often, every 1 to 3 hours? And if women don't have these questions addressed and encouraged to understand that frequent feeding, yes, it's common, it seems like it's very difficult, but things will get better and you are doing a great job, women may believe that what they're doing is just too onerous and they will turn to formula. So I think the most important thing in 2 weeks is talking about these issues, but also giving the mother great support and letting her know that what she's doing is absolutely normal and that she's doing wonderfully.
What are the major points you want to cover at the 2-month check?
At 2 months, oftentimes women who have been successful at that point are pretty much on autopilot with how breastfeeding is going, but do start with the barriers of going back to work and juggling work with pumping. They want oftentimes more freedom, so they oftentimes want to know how they can incorporate pumping and giving bottles of breast milk so that they have some freedom to leave their babies. Oftentimes we talk about vitamin D at that point, although the newest recommendation is to talk about vitamin D right after birth. And I think it's important to address with mothers whether or not they're having any issues with postpartum depression and just open up that door for them. I like to encourage them to talk to me about whether or not they're receiving messages from people around them regarding the baby waking up to feed at night or pressure to give solids, which are both issues that can lead women to wean early.
Can you expand on the vitamin D recommendations? You mentioned it in terms of specifics, amount.
So vitamin D is necessary for babies that are exclusively breastfed. Vitamin D is added to formula so that if babies are breastfeeding but also receive at least 500 ml of formula, they don't need vitamin D. but your healthy average breastfeeding baby does need vitamin D because breast milk does not have an adequate amount of vitamin D. So the recommendation used to be 200 units starting at 2 months, and just recently that recommendation was changed to 400 units per day starting at birth.
What do you advise women about contraception and breastfeeding?
Women who are breastfeeding should not take birth control pills that have estrogen. Estrogen at any point during lactation may decrease the mother's milk supply. A progesterone-only pill started at 6 to 8 weeks is certainly fine and should not interrupt her milk supply. However, I'm very leery about Depo-Provera shots because, first of all, Depo should not be used early postpartum. The earliest Depo should be given is at 6 to 8 weeks. But even at that point, there are many case reports of mothers having a markedly diminished milk supply with Depo shots. So I don't encourage Depo until perhaps 9 to 12 months postpartum.
What are the common concerns mothers have after the 2-month visit regarding breastfeeding?
After 2 months, many women may not realize that they can talk to their physicians about these issues. However, it's important to encourage them to express their concerns. One common one is how to introduce solids at 6 months. They oftentimes wonder if they should introduce solids first and continue the same frequency of breastfeeding. And I do recommend that they continue the same frequency of breastfeeding at that point, and breastfeeding will gradually diminish in its frequency by about 9 to 12 months, depending on the baby. They'll oftentimes talk about their concerns about nursing in public, and I'll reassure them that it is fine to nurse in public, that it's not illegal to be doing so. They'll oftentimes wonder if breastfeeding is the reason why their babies wake up frequently at night, and I encourage them to understand that breastfeeding alone is not the reason that babies wake up frequently, and there are many reasons why babies do this. And in fact, it's not necessarily abnormal for babies to wake up in the middle of the night.
What do you advise parents regarding introducing solids and iron supplementation?
Breastfeeding babies do not routinely need iron supplementation. Babies who were small for gestational age or who were premature may need iron supplementation, or who were ill for some other reason or had significant blood loss early on may need iron. A generally healthy term breastfeeding baby does not need iron supplementation. However, at 6 months when they start solids, it's important that these babies receive high iron solids, including early introduction of meats, dark green vegetables, oatmeal, and foods that are supplemented with iron, which would be cereals such as Cheerios.
What are the benefits of long-term nursing beyond 1 year?
Beyond 1 year, babies and mothers still gain significant benefits of continued nursing. In general, as a clinician, I find that babies are generally healthier that next year. Between 1 and 2, I see fewer ear infections, and we know that there's a lower risk of gastroenteritis for babies that are still nursing. There's also a marked decreased risk of obesity the longer a child is breastfeeding, such that they gain an additional 4% risk reduction of overweight with each additional month that they breastfeed, which is one of the greatest things that we can do to prevent obesity in children as they become adults. For women, with each year that they breastfeed, they gain an additional 4 to 12% decreased risk of type 2 diabetes and about a 4% decreased risk of breast cancer with every year that they breastfeed. So long-term breastfeeding is a very important way for women to decrease the risk of breast cancer. For women who nurse for at least a year, they have a 21% decreased risk of ovarian cancer.
How long should women nurse?
I encourage women to nurse for at least a year. And beyond a year, I think that it's a personal issue for the woman, her family, and her baby. But I do encourage them to nurse for at least a year. And I tell women, if you nurse for a year, you never have to introduce formula. So economically, it's advantageous for them just from that standpoint.
What are the main points you would like to leave the audience with about breastfeeding and well-child visits?
Breastfeeding success is a confidence game for women, and women need the support from their physicians and from the physician staff when they're in the office for routine exams. Women in this country are growing up in a culture where their relatives may not have breastfed, so they're doing something very different from the cultural norm that they're comfortable with. And so the doctor's office may be the only place where they feel that they're receiving the support that they need to be successful with breastfeeding. And so it's important for physicians to have this knowledge to support them.
Thank you very much, Dr. Eglash.
Thank you.